I'm Dr. Asim Javed and I'm an interventional cardiologist working at Rawalpindi Institute of Cardiology in Pakistan. This is a series of talks to facilitate learning of image interpretation in coronary intravascular ultrasound.
IVUS imaging, it's very important to identify the normal structures first. So this one is an IVUS catheter, and then the black shadow going like this is a wire artifact. Around the IVUS catheter is the lumen which contains blood. Outside the lumen, the first layer inside the vessel wall is this white line, that's the intima. This white lining is the intima. Then around it, the black line is the media. And outside this black line is the whitishness. This is all adventitia. It's important to see the thinness or fineness of the intima, because when the plaque develops, the plaque accumulates within this intimal layer, and then this white line spreads out and widens out. So again, identifying these structures, you can see here, that's the IVUS catheter. Depending on the gain settings, this is the guide wire artifact, then this is the lumen. Then around the lumen, the first layer that comes in is this white line, that's the thin intima. Outside the intima, this black line is the media. All around it goes all around like this. And then the whitishness outside this white intima is adventitia. Now, we must remember that three things that reflect the ultrasound rays poorly and therefore appear black are blood. Number two is smooth muscle, and then number three is lipid. So this media is all smooth muscle, therefore this appears black. This lumen, this whitishness appears black, and then lipid, we will see where we have the lipid deposition extensively within the plaque. That plaque will also appear black, that we'll see later on. But this identification is very important. So remember lima, going from inside out, lima, L is for lumen, then I is for intima, then M is for media, then A is for adventitia. So lima as we go from inside outwards. So what do we see here? Now this is an IVUS run of the right coronary artery. Let's see if we can identify the structures seen here. So what we see here is again that layer of lumen, intima, media and adventitia. Again, identifying these structures. So what is this? This is the IVUS catheter. The next, this is the lumen. But in the lumen, you can see, if you compare this lumen with the previous one, that was very black. This is very grayish. That depends on the gain settings of the machine. But these are all RBC specules that you can see here. Then outside this lumen, there is going to be a layer of intima. But before that, that's a wire artifact. And then that's now the first inner lining of the vessel wall, and that is intima. Then there is a black line that's called media, and outside that is this whitishness called adventitia. Now what's important to note, that intima starts here, that's the inner lining, but then media is not right adjacent to it. Media is way out over here. Why is that so? Because between this media and this intimal inner layer, this whole intima is really thickened because of the plaque deposition. So all of this is plaque. Now compare this intima with the normal intima. Look how fine, thin this intimal layer is and how thick this intimal layer now is. Now in the vessel structure, this is the lumen. The first layer that you come across is this white line, that is the intima, then the black one, that is the media, and then the whitishness, that is the adventitia. Now media has two borders, one border which is on the surface with intima, that's called internal elastic lamina, and then the surface or the border with adventitia is called external elastic lamina. So let's do a practice run now. You can see there's a coronary stenosis there, LED, and now that's the IVUS run. So let's have a look at this, and then I've got a still image over here. So if you carefully look at the IVUS run, and now if we start identifying structures, so that's IVUS catheter, that's a wire artifact going there, this is lumen, and then there is an eccentric plaque here, over there. Why eccentric? Because it is on one side, it's not equal on all sides all around, which could have been then called a concentric plaque. So here, if this is the lumen, then this line going there is the inner border of the intima, and all of this thing here is the plaque, and then this black line there, this is the media, and behind the media, this whitishness is the adventitia. Now identifying arterial branches. So arterial branches are, if you see a black structure here and it appears arteries, the arterial branches, as you are pulling your IVUS catheter back, you've taken it distally into the LAD, for example, to the distal LAD, and now you're pulling back your IVUS catheter and you're pulling towards the proximal side. So what happens? From distal to proximal, it's being pulled out. There is something appearing black on the periphery of the IVUS image, and then it's moving slightly towards the actual arterial lumen in which the IVUS catheter is sitting, and then as you come more proximally, it comes and opens into the artery. So this is an arterial branch. The arterial branch, how do you recognize it? It starts coming in to your image from the periphery, and then as you keep pulling your IVUS catheter back, it keeps coming close to the main artery, and then finally it opens into the main artery. And to the contrary, if you have a black image like this, which is not towards the periphery, it's close to the artery, and then as you keep pulling back, it runs parallel to the artery, it may run across the artery, it does not open into the main artery in which the IVUS catheter is sitting. So this is a vein. So remember, vein does not open into the artery. So arteries, the branches start from the periphery and move into the artery and open into the artery. The veins are not starting from the periphery, they are somewhere in the middle of the image, and then they run parallel to the main artery. They don't open into it. When you are in the proximal circumflex, at times you see an image like this. So this big dropout image with RBC spicules, this is the great cardiac vein. And when you come towards the distal left main stem, occasionally you see a triangle like this. This is called a triangle of Brock and Moshet. This is the bifurcation of the great cardiac vein. This is just to show you a practice run. Now this time this is the distal side and that's the proximal side when you're pulling your catheter. So here that's the main artery in which the IVUS catheter is sitting here. So what is A? A, if you see as we pull back, A runs parallel to the artery, never opens into it, so that's a vein. And this is the circumflex artery, so likely this is the great cardiac vein, it's so big. And then if you look at B and C, first B is coming in, it is coming in and it opens into the main artery. So that's a small branch. Then C is towards the periphery of the image. Then as we are pulling back, it's coming into the middle. As we pull back further, it comes and opens into the main artery. So this is again an arterial branch. Now at times you see these white shadows like this with spokes coming out like this. So this is pericardial refraction or pericardium. You see like this here. There's no significance of this, but you need to know, you should not be surprised what you are looking at. This is pericardium. Now again, there is something appearing on the top and keep looking at it. It's coming in and it opens into the main artery. So what is this? This is an arterial branch that comes and opens into the main artery. So if I see a still image like this, so that's the branch that's opening here. So this is basically a bifurcation. That's the carina, that's the junction between these two main arteries. And so this is a bifurcation. So this is a still image in which the IVUS catheter is being pulled back from the LAD. So as you are pulling back, you see this image. So there is the circumflex, and then this is your IVUS catheter, so that's your main LED. But then you have something here also. Is that an artery as well? Well, that's just calcium, and that's a dropout shadow. Whenever you have calcium, you can't see the vessel behind it, so that's called a dropout zone or dropout shadow. So that's not a bifurcation. This is a bifurcation, and that's the carina. And what's the evidence to it? As you pull it further back proximally, this opens into it and becomes one artery. That carina disappears and it becomes one artery because now the catheter is in the left main stem. The calcium is still persisting and there's a dropout shadow behind this calcium. So what is this now? This is the main artery, and there is a branch here and there is a shadow branch here. Likely this is the carina between these two. Likely this is a trifurcation. As you pull back, the doubt becomes sure that this is a trifurcation because now it's opened up into one big artery. So this was a trifurcation, and you pull it down back further, it becomes one main artery there. So this is the area of confluence, and then that's the main artery. So this is a trifurcation. Again, this is just a practice run to show you. So there is something of that was a vein that appeared here, and now again you can see some vein going down there, and then these two branches come and open into it. So I'll have to remove my laser pointer to stop this for you. So let me stop it for you, and then let's run it slowly. So what do we see here? So that's a vein. You can see there. You see this? That's a vein at 6 o'clock running all the way from 9 o'clock to 3 o'clock position. That's a vein. And then going back, and there. Two branches coming in on both sides, and there they open in. So that's a trifurcation. You see this? That's a trifurcation. Both branches were opening into it. So I'm going to put my pointer back. Other than this cross-sectional imaging on the IVUS, you also have this longitudinal sections. Here you can see very nicely, nice clean intimal layer bordering the lumen. But here you can see this is not as nice. This is all plaque in the intimal layer. So this is a diseased vessel. Even on the longitudinal section, you can see that. This is a 79-year-old lady came in with unstable angina, and you can see that there is a critical disease in the LED. The dilemma here was that there is a good size diagonal, that's the diagonal that comes off very early from this LED, and I wasn't very sure about the ostium of LED because this branch was continuously overlapping it. So you can see here LED and diagonal are overlapping in this segment, and the exact location wasn't very clear to me. So I finally did an IVUS image, and this is what the IVUS showed. So what you see here is that that's the main LED you're pulling back, and you see this wire coming back. This is basically the diagonal branch in which I have the wire, and you see that branch opening here, and that's the circumflex on the top that comes in. So let me again remove my pointer and let me control this image for you. So let me pause it here. So there you go. So on the 3 o'clock position, you can see a wire coming in and a branch coming in, and that's, there you go. So that's the diagonal branch. There, that's the diagonal branch, and as it opens up, you still have ostial foothold in the LED, and at 12 o'clock you have the circumflex. So that's what it is. This is the circumflex, that's the LED, and that's calcium in the LED. There's dropout shadow behind LED, but that's the LED ostium. And that diagonal branch was right here opening into it. I'll show you the diagonal branch again. There, that's the diagonal branch. Now you can, in fact, you can now see all three. That's the diagonal coming in, that's the circumflex coming towards the LED, and then as we go further back, it will open into the left main stem, and that's the left main stem. Okay, so Putting the pointer on. So finally we found this image where we could, this is a very modified deep areocranial where I can see some foothold in the ostium of the LED, because now on the IVUS run I had seen that there is an ostial foothold which I can utilize. So in this image I finally decided to wire and put my stent. So that's what we did. We wired the diagonal. We brought in the LED stent. This is a 2.7538. So whenever I do ostial stenting, I always take a contrast injection with the stent balloon inflated, so that it gets recorded as to exactly where I've put my stent and how it looks. So you can see here, I think it's a nice position to nail the LED ostium, and that's the final result. So IVUS was very handy in this case to decide where to really put the stent, and if I had a foothold or not. And this IVUS image very clearly shows that we've put the stent right in the ostium. So necrotic core, I've already said that blood, lipid and smooth muscle are three things that appear black on the IVUS image. So if you have a plaque like this, that's an eccentric plaque, and within the plaque you have this black shadow like this, black space like this within the plaque, that's a very lipid rich core plaque. That's lipid that appears black here. And if you have a plaque like this which has a black lipid core here and a very thin layer of intima on top of it, that probably falls into the definition of a thin cap fibroathyroma, which on OCT you can measure, and if it's less than 65 micron, that's a thin cap fibroathyroma, and this could be a vulnerable plaque. So you get different types of plaque. You get a soft plaque, and soft plaque has a brightness which is not as bright as the adventitia. So when it comes to brightness, you always compare brightness with the adventitial brightness, which is outside. And this is all collagen layer. The adventitia is all collagen. So this, you see, is less bright as compared to adventitia, and this is soft plaque. Now, if the brightness is almost the same as adventitia, or could be even brighter, so this could be fibrotic plaque, and fibrotic plaques usually do not have a dropout zone behind them, because two things that appear very bright as the adventitia or even brighter are either calcification or fibrosis. So in calcification you have a dropout area behind the calcium where it's not really very visible, but with fibrotic usually you can see the vessel structure behind it, but at times even the fibrotic band is so bright that you may get a dropout zone behind the fibrotic band. And this is now calcification, where it's much more denser as compared to the adventitia. It's much brighter, and then there is dropout zone right behind it. It's all black. You can't see anything where the calcium is. So this is calcification.